What is genetic counseling for cystic fibrosis testing? Imagine learning about your chances of passing on a condition that affects the lungs and digestive system. That's where genetic counseling for cystic fibrosis testing comes in. It's a process where trained professionals help individuals and couples understand how cystic fibrosis is inherited, what their personal risks might be, and what testing options are available. This guidance is crucial because cystic fibrosis is caused by mutations in the CFTR gene. To have the disease, a person needs to inherit two faulty copies of this gene, one from each parent. People with only one faulty copy are carriers. They usually don't have symptoms but can pass the mutation to their children. During counseling, the professional will review your family medical history to see if there are any patterns or known cases of cystic fibrosis. They will explain how the disease is inherited in an autosomal recessive way, meaning both parents must pass on the mutation for a child to be affected. They'll discuss what it means to be a carrier and how common carrier status is in different populations. Next, they will go over the types of genetic tests available. Carrier screening panels are common and can detect many of the most frequent CFTR mutations. These tests are simple blood or saliva samples, and they help identify whether someone is a carrier. Counselors will also talk about the benefits and limitations of testing. For example, carrier screening can tell you if you carry mutations but may not detect all possible mutations. They will discuss what the results could mean for you and your family, including the chance of having a child with cystic fibrosis. If both partners are found to be carriers, the counselor will explain the risk of passing on the disease. They will also discuss reproductive options, such as prenatal testing, which involves sampling fetal cells through procedures like chorionic villus sampling or amniocentesis. These tests can detect CFTR mutations in the fetus early in pregnancy. In addition, genetic counseling covers the option of newborn screening, which is widely used to identify infants at risk for cystic fibrosis shortly after birth. Early diagnosis allows for prompt management and better health outcomes. It's important to remember that qualified professionals like board-certified genetic counselors or medical geneticists provide this guidance. They ensure that the information is unbiased and based on current scientific understanding. In summary, genetic counseling for cystic fibrosis testing is a vital step for anyone considering testing or wanting to learn more about their genetic risks. It provides clear, accurate information about how cystic fibrosis is inherited, what testing involves, and what options are available. This helps individuals and couples make informed decisions about their health and future families. Always consult healthcare professionals for personalized advice tailored to your unique situation.